Hello, I'm Austin Graham. I'm a fourth year medical student working with your doctor. So what I'm going to do today is perform a physical exam. I'm going to start by washing my hands. How are you doing today?
Great.
Good. Nice to meet you. If you don't mind, if you sit towards the edge of this bed with your legs dangling over. What I'm going to start with is I'm just going to look general appearance here. I'm just looking at your skin, looking to see if I see any changes to the skin color. Have you noticed any changes to your skin color? No? Okay. What I'm going to do first is if you don't mind looking at my finger and following it. I'm just looking at your eye movement here, making sure I don't see any abnormalities. Okay. Next what I'm going to do is I'm going to dim the lights. I'm going to check for your pupils. Okay, if you could just look past my shoulder towards the wall. If you could for me, could you pull down your eyes right here in the front, your lower lids? I'm just looking here for any changes in coloring. If you could look up for me. Okay, great, thank you. Okay, so now next what I'm gonna do is I'm gonna take a look in your ears. Okay, everything looks normal there. Next, I'm going to have you, if you open your mouth for me, stick out your tongue and say, ah. Okay. Next, what I'm going to do is I'm going to feel for your lymph nodes. Have you noticed any changes, any masses or tenderness in your neck? No? Okay. Next, I'm going to feel for your preauricular nodes, your postauricular nodes, your cervical chain, and your clavicular nodes. Okay. All right, so next what I'm going to do is I'm going to feel for your thyroid.
Okay.
If you could, you swallow for me. Okay, great. Everything on your thyroid feels symmetric. I don't feel any masses or anything out of the ordinary. Next, I'm going to perform your lung exam. I'm going to start by tapping on your chest. I'm going to percuss your lungs on your back in a ladder type fashion. Do 4 pairs. Next, I'm going to percuss on the sides of your lungs. If you could place your arms up like this for me. Okay, great. You can place your arms down to your side. Next, I'm going to listen to your lungs. 4 pairs in a ladder-like fashion as well. Take a deep breath in and out. 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 Could you place your arms like this for me? I'm going to listen on the sides as well. If you take a deep breath. Take a deep breath. Okay, great. You can put your arms down to your side. So next what I'm going to do is your cardiovascular exam. So I'm going to take a listen to your carotid arteries in your neck. If you could you turn your head to this side for me? Take a deep breath in and hold it. Okay, good. You can breathe out. Now can you turn your head to this side? Again, take a deep breath and hold it. Okay, great. Next what I'm going to do is I'm going to palpate your carotid arteries one at a time. Okay, on this other side here. Okay, great. Next what I'm going to do is take a listen to your heart. I'm going to pull your gown down here, and if you wouldn't mind holding it right here. Listening to your aortic valve over the right second intercostal space. Listening to your pulmonic valve over the left intercostal space. Listening to your tricuspid valve over the fifth intercostal space. And I'm listening to the mitral valve over the fifth intercostal space in the midclavicular line. And place your gown back over your chest. Next, what I'm going to do is I'm going to feel for your radial artery pulses in your wrist. If you could turn your wrist like this for me. Okay, great. Now I'm going to feel for the pulses in your feet. Great. Now next, I'm going to have you lay down and I'm going to listen to your heart again. I'll grab it. Blanket here and drape it across you first. Place it over your lap. And have you lie down, and I'm going to pull the stool out for your feet. Okay. Are you comfortable there? Mm-hmm. All right, great. What I'm going to do again is I'm going to pull your gown down. I'm going to take a listen to your heart again while you're laying down. I'm listening over the aortic valve. I'm listening over the pulmonic valve. I'm listening over the tricuspid. Now I'm listening over the mitral valve. Next, I'm going to perform your abdominal exam. So I'm going to have you lay flat, if you would. I'm going to lower your bed a little bit more here. Is that comfortable?
Yep.
Okay, next I'm going to have you raise your gown up. That's okay. All right. Next, I'm just taking a look at your abdomen, looking for any changes to your skin, looking to see if I notice anything out of the ordinary. Everything looks normal here. Next, what I'm going to do is take a listen over your abdomen. Okay, great. I don't hear any abnormal sounds. Everything sounds like it should. Next, what I'm going to do is I'm going to percuss your abdomen. And again, I'm just listening for any changes. Next, what I will do is I'm going to palpate your abdomen. And I'm going to push down. First lightly. Let me know if you feel any pain. Any pain over here. Any pain over here. Any pain over here on this side? Next, I'm going to push a little bit harder. Any pain here? Any pain here? What about down here? No? And any pain here? Okay, great. So next what I'm going to do is I'm going to feel for your liver. Can you take a deep breath in for me? And deep breath out. Okay, great. Next, what I'm going to do is I'm going to tap to find the top portion of your liver. I'm going to come here to the midclavicular line, the level of your nipples. I didn't hear any abnormal bowel sounds. You didn't have any tenderness to palpation, and your liver was 6 centimeters. which is normal. Next, I'm going to feel for your spleen. I did not feel your spleen, which is also normal. I'm going to pull your gown down. I'm going to have you sit back up if that's okay. Next, I'm going to do the neuromuscular exam. First, I'm going to start by testing your strength. If you could hold your arms up like this at the side, just testing your shoulders. If you could hold your arms out in front of you like this, I'm checking the strength in your biceps, strength in your triceps. Okay. If you could have your hands, this arm, if you could bring your wrist up like this and bend it backwards. Don't let me push down. Okay. If you could turn your wrist like this, don't let me pull you out. Okay. Same thing on this arm. Don't let me push and bend it down. Don't let me pull you. Great. Next, I'm going to test the strength of your hands. If you could have your hands like this and grip, squeeze my fingers as tight as you can, and don't let me pull away. Good. Okay. Next, I'm going to test the strength in your legs. If you could raise this leg up for me. Don't let me push down. Okay. Same thing on this side. Don't let me push down. Now I'm going to test the strength in your lower legs. If you could push out against me. Great. Pull against me here. Great. If you push down like you're pushing on the gas pedal and lift up towards me, great. All right. Next, I'm going to check your reflexes. I'm going to start here with your biceps reflex. If you could turn your arm like this and just relax this arm. Okay, great. Next, I'm going to test your triceps reflex. If you could lift your arm up like this, I'm going to hold on here, just go ahead and relax. Okay. If you lay your arm flat here, I'm going to test the brachioradialis reflex. Good. I'm going to do the same thing on this side. First, I'm going to test your biceps reflex. If you could just relax this arm for me. Next, I'm going to test the triceps reflex, again at your side. And if you could lay this arm flat again, I'm going to test the brachioradialis reflex. Good. Next, I'm going to check the reflexes in your legs. I'm going to start here first with your patellar reflex. If you could just relax this leg for me. I'm going to test this side now. Okay, great. Next, I'm going to test your Achilles reflex. I'm going to test this side now. Next, I'm going to perform the Babinski reflex. Okay, good. Next, I'm going to have you walk in the room. If that's okay, if you could go ahead and stand up for me. I'm going to pull this out for you. Okay. If we could walk over here. If you go ahead and walk towards this side of the room for me, just normally. Okay. If you could walk back towards me. Okay. Now if you could turn around and walk that way. And now do your heel to toe like this for me, like you're walking, try to walk in a straight line. Okay, now come back towards me. And same thing, heel to toe. Great, okay. Now you can have a seat back down here on the exam table. After performing your physical exam, I did not find any abnormalities. Your heart sounded normal. I did not hear any murmurs. Your lungs were clear. Your abdominal exam was normal as well. Your neuromuscular exam was normal. Your strength was equal on both sides. Your reflexes were normal as well. What I'm going to do next is I'm going to go talk with your doctor, explain some of my findings. What we'll do is we'll come back in about 10 minutes if you want to go ahead and just sit here. And we'll come back in and talk with you. Does that sound okay?
Great, right?
Great, yeah, thank you.